Something we always tell patients is write your questions down. Because you get in there and you're anxious, of course, you just got diagnosed with leukemia. Anybody who's anxious finds it hard to pay attention, even if it's something really important to them. It's great if you can bring somebody with you who can be sort of an objective person who can be a little less stressed. Probably if there's somebody who cares about the patient, they are stressed, but they're not as stressed as the patient. And write them down, because what will happen is you get into the office, and hopefully if it's a good doctor, they'll kind of take you through it and give you an overview how things are going to be, but there's always some questions that you're going to ask. And you'll get into the office as the patient and you'll be like, oh, I forgot what I was going to ask. So it's really important to write down the questions that you have before you go in. And if you're going for a second opinion, a good thing to do is have the doctor who is seeing you at home tell you what they think should be done. Because you might find out when you go for a second opinion that that's exactly what that center thinks. And although I make a point that sometimes experience is better, sometimes people don't have the wherewithal to, say, uproot themselves and move to another city where they were, or 200 miles away in order to get the treatment. So at least if you know what your physician is planning to do and you go in and you find out that at that expert center they think that's a good plan, you'll come away with a lot more confidence.